Immunotherapy works with the body's own immune system to kill cancer cells. The body's own immune system has the ability to detect abnormal cells like cancer cells. However, cancer has the ability to essentially hide from our body's immune system. Immunotherapy enables our body's own immune system to better find the abnormal cancer cells, thus treating cancer. There are many different types of immunotherapies. Some have more specific side effects than others. At the end of this video, your provider will discuss any specific side effects associated with your particular immunotherapy. In general, the side effects of immunotherapy often include an inflammatory response, which can affect any organ system. So let's talk about some of the more common side effects of immunotherapy now. The skin can be affected by immunotherapy. If this happens, you may develop a rash. Your rash may look different than other rashes you've had before. Please do not put anything on your rash until you have spoken to your provider. You may also experience itching of the skin after your infusion. This can be normal. Make sure to use a good hydrating lotion and lather your body after showering each day. Immunotherapy can affect your lungs. This is called pneumonitis. It results in a change in breathing, shortness of breath, chest pain, or a new or different cough. Obviously, for severe shortness of breath or chest pain, you should go to the emergency room or call 911. Otherwise, you may reach out to us for additional instructions. Immunotherapy can also cause some inflammation around the stomach. This can cause nausea. If you have nausea and do not have anti-nausea medication, or if you are taking your nausea medications and they are not working, please call us. The colon or bowels can also be affected. This is referred to as colitis. When this happens, patients can experience significant diarrhea. Typically, we suggest Imodium for diarrhea. If you are experiencing diarrhea that is not well controlled on Imodium, or if you have more than 4 loose stools and have significant cramping or notice blood, please call. There are additional medications or testing which may be appropriate. Immunotherapy can also cause inflammation of the liver. We are monitoring this regularly with blood tests. However, if you notice yellowing of the eyes or skin, please contact us. Immunotherapy can also cause inflammation of the pancreas. If you are diabetic, make sure you are checking your blood sugars routinely. We are also monitoring your blood sugars regularly with blood work during treatment. The thyroid is often affected with immunotherapy. Most of the time, patients don't experience any symptoms, but you may notice us checking your thyroid function from time to time. You may notice a decrease in your energy. However, you should be able to maintain and complete your usual day-to-day activities. We encourage patients to stay active when they can. In fact, the best way to improve fatigue is through exercise. While infusing immunotherapy, sometimes your body can react. If this happens, your infusion team and providers are trained to handle the reactions. As you absorb these antibodies, you may sometimes notice flu-like symptoms. Similar to how you might feel after you receive a vaccine, you may experience low-grade fever, body aches, and fatigue in the first few days after the infusion. This tends to lessen as treatment goes on. Some other more rare side effects to be aware of include if you have an underlying autoimmune disease, these may flare with immunotherapy. If you have a reactive arthritis, you may experience more joint pain. If you have ever had hepatitis A, B, or C, these could flare as well. Overall, side effects of immunotherapy are typically mild, and generally, immunotherapy is well tolerated by most patients. If you are experiencing side effects or something that was not covered in our video or by your provider, please do not hesitate to contact us. You can use the triage number or our after hours number.